we are going to go over how to complete an occupational therapy treatment visit or a COTA visit. You need to, first off, check patient identity. We do ask that treatment visits are at least 40 minutes. You need to have the medical diagnosis here, OT diagnosis here. If you are a COTA performing these visits, the medical diagnosis and OT diagnosis will need to emulate what was documented within the evaluation. Homebound status is always checked yes, as we are performing home health. Criteria 1 is and or, so one of these two boxes needs to be checked, and you need to specify. Here are multiple examples below. You only need one. Criteria 2, this is and, so both boxes need to be checked, and again you need to specify with at least one example. Vital signs, you need to take at least one. Prior is currently filled out here. We do suggest maybe during and post, but you need at least one, and if for some reason you are unable to assess the patient's vital signs, please elaborate why down here in the comment section. Also in the comment section you can state who you coordinated with if the vital signs are out of parameters. Subjective information, what the patient tells you goes here, along with your COVID screening. Here's an example. Pain assessment, if the patient does not have pain, you select here. If the patient does have pain, this is the site. The pre-treatment and post-treatment pain needs to be added. Increased by, relieved by, interferes with, these also need to be addressed. The objective evaluation and training interventions needs to be addressed. Please do not leave any of this blank. Just add what is necessary. Same with bed mobility. Select how they're doing this treatment visit, and then the deficits and how you addressed with interventions. Transfer training, the current status, how you addressed, and then current deficits are due to. Please address each of these appropriately, as this example shows. Self-care, skills training, please address each section with interventions added. If the patient is independent, you do not need to add the interventions, as you are probably not addressing. Please elaborate deficits due to comments. This is also, often a reason that notes will be returned to you through QA is if the deficits due to and comment section is blank. So please elaborate. Just more examples. ADL training, cognitive status and perception training, test and measures. If you wanted to complete a test and measures, you're more than welcome to. Typically, if you want to wait to perform these with assessments, if you're an occupational therapist, you can wait till then. If you're a COTA, you do not need to perform these with each visit. Here are the section where you're going to elaborate on the individualized therapeutic exercise that you performed with the patient. You will check these boxes as appropriate and then fill out the information here. Teaching, you need to always provide something within each treatment visit. Not every single box needs to be checked, but you need to at least have one checked, and who you provided the teaching to, be it the patient or the caregiver. And then this is not filled out. I would suggest filling this section out. Did they demonstrate understanding? And if not, any comments? And then do they require further teaching? This example shows the patient does. And here is the titles of the tools given. Home exercise program. The goals need to be addressed with each treatment session. There's an entire video where we show you how to address these goals. So please feel free to view our other videos, but you will select this and then you will go in and address each individual goal. Functional limitations, please fill out, check the appropriate boxes. Plan, skilled intervention always needs to be checked, and you need to elaborate below here. Discharge planning always needs to be checked. You do not have to elaborate. Why is discharge planning checked? The reason is we are always planning for discharge at some future date. We are trying to progress the patient towards their highest level of independence. You need to add some coordination, be it with the occupational therapist if you're a COTA, or if you're a coordinating with the skilled nurse, but you need to add some type of coordination with each visit. Please do not leave blank. You can save templates. You can update templates by coming here, selecting this, typing in the name of your template, and as soon as you hit save, it will save that for a future visit. And that is how you complete an occupational therapy treatment visit.